Welcome to episode number 309, where I'm speaking with Dr. Sujatha about the Ayurvedic view on heart disease. And we talk about the relationship between the doshas and the mental gunas and the Western medical classification of heart disease, plus why the heart is considered the most vital organ in Ayurveda. And Dr. Sujatha gives lots of tips on taking care of your heart health. So please stay tuned. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. Hello, and welcome back to the Elements of Ayurveda podcast. Today, I'm very happy to welcome back a regular guest, Dr. Sujatha Kekada, who is head physician and co-founder of Amirta Siddhi Ayurvedic Clinic in Ubud, Bali. Dr. Sujatha is a certified Ayurvedic doctor with a degree from Rajiv Gandhi University. Dr. Sujatha, welcome back to the podcast. It's great to have you here.
Thank you, Colette. Thanks for organizing this wonderful knowledge sharing episodes of podcast that you organize. Thanks for inviting me back again. Thank you.
Oh, I love our conversations, digging into the diseases. It's great. And before we get started, our conversation today, can you believe it's less than 2 months to our retreat in Bali? Time is flying.
Yes, it is. And I look forward to see you. It's been a while, and look forward to see all those Ayurveda enthusiasts who want to improve their health, well-being, and make some changes.
Yeah, we have a great group already registered. And just let people know out there, there are a couple of openings still available. So register very soon if you want to join us in Bali from December 4th to the 10th for this 7-day rejuvenation retreat and get away from all that holiday craziness and really enter into a healing cocoon away from your daily stressors for 7 days of healing, treatments, yoga, mindfulness, not to mention delicious Ayurvedic food tailored to your needs, a supportive environment as well, like-minded people, and of course the Ayurvedic doctors, and a whole program tailored to you. So it's such a great opportunity. And I think it's so great to experience that being plucked out of your regular life and go into, as I always call it, the healing cocoon of Amirta Siddhi, where you're just away from all those daily stressors. And it's such an amazing experience. And you're in the healing energies of Bali as well. So please come join us. Like I said, there's a few spots still open. So check out the link in the show notes for more information and to register. Okay, Dr. Sujatha. So our podcast episode today is on the Ayurvedic view on heart disease. And just to let you know, I recently did some solo episodes on Ayurvedic herbs, and I covered in one episode Ayurvedic herbs for the heart. And in that episode, I discussed briefly how the heart is considered the most vital of organs in Ayurveda because it's the seat of the 3 doshas, of prana, of the rasa vahashrotas or the plasma channel, of the 10 great vessels of the body, of ojas, and of the mind. And with the heart being the root for all these energies, shrotas, and our prime energy reserve, etc. It means that it can be really affected, right, by the imbalances in the dhatus and the doshas and the shrotas and the mind. And as I said, I discussed this briefly in the episode, but I'd love for you to expand further on this, the importance of this vital organ and how it can be affected by the fact that it's the seat of so many of these energies and shrotas and dhatus.
Absolutely. Heart, other than what you already mentioned, it's also one of the vital marma points. As we know, marmas are areas of energy concentrated, sensitive part where injured to this particular marma, which is called sadhyo pranahara marma, means once it is injured, it can create, it's fatal and it can cause death. And from what you mentioned before, it's the root of the mind. It's also connected to the rasavahasrotas, ojas, prana, tridosha. So it's very, very important. And heart in Sanskrit also means center. So it's like heart as an organ we have got. It's also represent center of each and every cell. That means the nucleus, which carries the intelligence of life or the buddhi inside us. So that's how it's also connected to the manovahashrotas, meaning connected to the functioning of the mind. So that means whatever happens in the mind, it also reflects in the each and every cell in the cell. And hence it's also a combined effect. Itself can be manifested on a system wise in our cardiovascular system or in the heart. So we cannot separate the functioning in the heart from the what's experienced in the mind. And Charaka and Vagbhata, they both, the masters of Ayurveda, they both connect like a, shoka means like a sadness or trauma or grief or anger, these kind of emotional things affecting your heart directly. And they also talk about a lot of different things like a laughter, joy, happiness, which also enhances the health of the heart. So there is a complexity connection to heart from your mind and your cellular function, cellular energy, how your cells perceive emotions, which is experienced through different chemicals. And we know that, our heart rate can be easily affected by emotions. So which is something we don't need to go to a lab or test. We know when we are anxious or worried or scared, our heart rate increases. But when you're joyous, it becomes mellowed down when we meditate. So a lot of mental activities, and through mind, we can control the health of the heart. And plus, we talk in more detail about lifestyle and diet and influence of the doshas, how heart diseases can be manifested and what are the lines of treatment.
Yeah, absolutely. And good point on the marma. And the fact that if there was a sudden shock to the chest or heart area, that can be a result in sudden death due to the fact that the marma point is there. Yeah. And yeah, absolutely. Because it makes sense that if rasa and prana, and particularly ojas, our prime immunity, is the seat of that is in the heart, and that is circulated around the body, of course, then it's going to affect all the cells and dhatus or tissues and so on. And so what are some of the early signs of heart disease, and what's happening in the body or mind to cause these imbalances? And of course, heart disease comes in many forms, but if you could talk in general about that.
But the primary symptoms Ayurvedic classical texts talk about is some feeling of tiredness, not having chetana, that means not having this inspiration, cheerfulness, all those things can be indicative of heart diseases. A feeling of, literally there's an explanation, says a feeling of like somebody placed a heavy stone on your chest. That's one of the symptoms they mentioned, that it means gurutva. That means your heart feels heavy, as if somebody put a heavy stone on your chest. And also, it also talks about some sort of pain in the chest area, or radiating up, down, or in all the directions. So these are the primary symptoms. And then when it is affected by different doshas, they have a different symptom. So if it is affected by kapha, people can experience low blood pressure, dizziness, pallor, that means, paleness in their skin, tongue, these kind of things. And when it is pitta, burning sensation in the chest area, inflammation, inflamed joints, these kind of stuff. And vata, increasing heartbeat, irregular heart rates, and mind feeling agitated, confused, even delirious. These are the symptoms mentioned when it comes to a heart disease as such.
Okay, great. So they're like the early signs that there's a problem going on, the early signs of disease, right? And so, like I said, there are many different types and symptoms of heart disease, like coronary artery disease, heart arrhythmias, which are referred to there, heart failure, heart valve disease, pericardial disease, cardiomyopathy, congenital heart disease. It goes on and on. But can we make a correlation between these diseases and the dosha types?
Absolutely. Yeah. in a coronary heart diseases, which are mainly by blockage in the coronary artery, which we can correlate to, can be involvement of both vata and kapha. But when the plaque build up, blockage in the coronary artery happens, it's purely related to kapha, cholesterol, calcium plaques, or both together, which blocks. That means kapha, which should be giving bala, strength, elasticity. Instead of that, it's clogging, plugging something and preventing the flow. And also we can see like a stenosis where the arteries or the major supplying, your aorta or pulmonary arteries, jugular vein, carotid arteries, they can get hardened, hence they can create constriction, which can be symptom of increased vata in the body, which is prevalent and all part of the body, but it's affecting your channel, shrotas. It begins in the mahashrotas, or the rasavashrotas, and then it can go directly into your heart, and the heart muscles becoming hardened, losing its elasticity. So it's not doing the pumping action. In pitta condition, we can see that inflamed pericarditis or infection, cardiomyopathy, all those things, weight, inflammation affecting the muscles, or some autoimmune conditions, rheumatoid fever, which is affect the joint, plus it affects the heart, which is common in young children, where it leads into the valve being, damaged. So that's related to a pitta related condition. So, treating a disease, it helps us to understand which dosha is out of balance, in the site, but the imbalance is in all over the body. So we take a general measure to reduce these increased doshas, to create the physiology back to normal. Hence, the approach to the treatment varies, understanding the different disease. And what in Ayurveda, we always look into pathogenesis, how the disease manifested, what is the process here. Once we understand that, the treatment is much more easier. And hence Ayurveda can do this. A lot of the time we can prevent the disease from further manifesting or getting worse or having a secondary condition. Mm-hmm. So this is where the relationship of doshas into Western way of understanding cardiac diseases.
Exactly. And yeah, the importance of catching it early, right? Because it has such a huge influence in the body, and it can affect all other areas of the body as well, and the mind. And talking about the mind, we just talked about how the doshas can be correlated to specific types of diseases. And so too, the mind. I want to talk a little bit more about this connection with the mind and heart disease. And so looking at the mental gunas of rajas and tamas, can we see a similar correlation there? You mentioned emotions that can affect the heart earlier, like sadness and grief and anger. Mm-hmm. Which in turn will affect the mental vikriti, right? The mental gunas, the qualities of rajas and tamas. And so can we see a correlation with heart disease and these mental disturbances or the qualities out of balance?
Yes. It's not like a direct, when we feel rajas, let's say, for example, excessive anger is bad for heart. That's mm-hmm. what clearly the textbook says. Mm-hmm. And anger is a predominant emotion related to rajas quality. Mm-hmm. So, in that way, constantly a person being rajas, very intense and achieving competition, jealousy, all those emotions leads into anger, because rajas is wanting more and active energy. And when things doesn't go well, anger would be the primary emotions of rajas. Where in the case of tamas, which is stagnation, dullness, lethargy, inactiveness. So that means heart is not getting blockage of the coronary artery could come from a lot of tamas being in the mind state. That will trickle down into the physical way of inactiveness, indulging in food that doesn't support the heart health, overeating, obesity, cholesterol buildup, excessive fat tissue buildup around the heart tissue, different part of the body. So basically dullness, stagnation, nothing moves. And heart is an organ of circulation. It needs to circulate. It circulates blood. It circulates rasadhatu. It circulates ojas. It circulates prana. So when there is tamas, there is a lack of circulation in a subtle level and in a gross level of blood itself. So hence tamas quality can lead one's lifestyle and diet in increasing kapha and creating stagnation. In the same way, a rajasic mind can aggravate pitta and leave the lifestyle and wanting more and indulgence in rajasic diet, lifestyle, alcohol, partying, in recreational drugs and all those things. So it makes the heart to over-intensify, over-function, and leading into inflammation and then irregularity of heart muscle functioning signals, and all those things can lead into a disease. So this is how the dosha can influence by the state of the mind.
Yeah. Okay. Great explanation there. And it is like that rajasic mindset is all in the pursuit of pleasure. And then tamasic is more in that inertia, like you said, that lethargy.
Attachment without no light.
Yeah. And so Ayurvedic treatment, of course, is tailored to the manifestation of that particular disease and the rogi. But do you have some examples of a holistic treatment or for a particular type of heart disease that you have experienced, or case studies that you can share with us?
Mm-hmm. I've had few cases of heart diseases. The condition one important case I remember, this patient who initially came to me for treating diabetes, and diabetes got better. He got rid of all this medication, and then a couple of years later he approached me again because he was getting a low heart rate, and the doctors diagnosed that he's having his pacemaker is not working well, and the nodes which generate electricity to conduct the contraction of the heart is not working well. Hence his heart rate was very low, and they said, okay, you need to go on a surgery, you need to get an artificial pacemaker. But he didn't want to do it. And once he got rid of all his diabetic medicine, he was completely he didn't want to go to allopathic doctor anymore. He didn't believe in them. Hence he came to me and I treated with various different Ayurvedic treatment. Plus he did panchakarma to clean up the imbalance of different doshas. So there's an involvement of vata, there's involvement of kapha. Both doshas are involved when your nodes are not working, which creates electricity for your heart to send a signal to heart to contract and relax. Mm-hmm. So we treated both of those issues with various different treatment, particularly with the Urabasti, other than the regular bastis for vata, and doing some virechana. So eventually he didn't have to go and see a cardiologist and have the surgery, and his heart rate came back to normal after a couple of months, plus the panchakarma treatment. So he's good. Still now he's functioning very healthy, fit, doing all the gym works and stuff. He's in his end 60s, all going well.
Great. And can you explain Urabasti for people listening who are not familiar with that, please?
Urabasti is a treatment. You create a dough with flour on any area. It could be done on the ura from the chest, where we're treating the heart condition to give the strength and reduce the vata. In condition of grief, sadness, where we feel chest is blocked, we can't take a proper breath because of trauma. The cells around your chest muscles and intercostal muscles, they are stagnant, and particularly heart is also very heavy. So after massaging the chest area, we make a big donut, you can say, to cover big enough to cover the area of the heart. Mm-hmm. And then we pour warm medicated oils into that donut to keep the oil. This treatment goes for 30 minutes. We keep the oil until it turns lukewarm. We change that oil into warm oil again. So repeat it for 30 minutes of the time. So this helps to open up the channels, relax the muscles, bringing more ojas, more prana into the heart area by relaxing the muscles, and the heart starts to heal as the prana and the ojas comes back to its original seat.
It's just so wonderful. The Ayurvedic holistic system of healing, you're getting it from all angles, the therapies, physically through the food, and then also the emotion.
Yeah, the holistic approach need to happen from all the sides, not just giving a also looking into what caused. You need to, if it is a trauma or imbalance in stress hormones or anything causing, you want to undo those things. Yoga, diet, meditation, gentle breath work,
Yeah. I do believe that it's so important for the rogi to be an integral part of their own treatment and to understand what's happening, and also uncovering those layers of emotions or stressors and so on that maybe have a part to play in this. I think that makes such a difference in their healing journey, right?
Mm-hmm, mm-hmm. Yeah, we call, like, if you look at the beauty of the heart, I give this example. A heart feeds the whole body, as it pumps the blood through the aortas, superior and inferior, like, it circulates. But heart has its own circulation. That's the coronary artery. Mm-hmm. So if the coronary artery get blocked, the heart stops. Right? So that means this is also symbolism in our life that if we don't take care of ourselves, we're constantly taking care of others, you're not able to do that. Even your heart, which takes care of the whole body, it need to take care of it first. And if it stops, then it can't do the other thing. So with this way, the design and seeing the nature, how the body is created, even the organ is created in that way. If we don't listen to our emotions, our feelings, our needs, and we ignore that, and at some point we start feeling really tired and have no energy, no motivation, and then we drink coffee, or still we need to perform, we drink alcohol. So we try to get this fake energy and upliftment. And further, the heart is tired and exhausted. So doing this external force hitting to, wake up the heart or stimulate the heart with enhancing the circulation, waking up your brain and telling the heart to do its function. It's temporarily works, but on a long time basis, your heart is shut down because it's been not taken care and emotionally shut down too. So, your heart becomes overburdened, like a cardiomegaly. It's one of the conditions where the heart becomes so big, where heart cannot keep up with the emotions that you blocked and stored. So it has to grow bigger and then it gives up.
Absolutely. And, our environment came into my mind when you were talking there about how, and it's particularly important right now because we're going through a seasonal change and our clocks are about to change soon in most places. But there's been studies done how just that shift in an hour time change that we go through during the transition of the seasons, there's an increase in heart attacks around that time. So our environment and our alignment to nature and understanding that at the change of seasons, we may be feeling this shift in energies, and to respect our bodies and take more rest and do Ayurvedic cleansing like we talk about. We need to be in tune more and not just try to push and drive at 100% every day, thinking that we can do that day in, day out, that we recognize our menstrual cycle, our seasonal cycle, our age, and so on. All this has an effect that we really need to respect and pay attention to.
Absolutely, no doubt. And heart is one organ, but they all represent different seasons and different time of the day. So it's important that, like, early morning are the times for heart attack, and there are certain things. Right. Ayurveda, particularly talking about heart condition, one of the common thing Ayurvedic textbook says about not to consume yogurt at night, and it says that if you consume yogurt in the evenings in the kapha kala, it's going to cause blockage of your heart channels, and you're more prone to get heart attack.
So the kapha kala being the kapha time from 6 p.m. to 10 p.m.
Yes.
Wow.
Yeah. And it's a one of the ritual that in a lot of the Indian households, like if you grow up with your grandmas, they always say no yogurt in the evening.
Because it's kapha provoking qualities.
Kapha provoking, and yogurt has a quality to increase the moisture. It increases the secretion. So you take that in the night, and when it increases the secretion, means we're not moving. So circulation is compromised, and this secretion is going to accumulate in your channels. Imagine you have a channel which is partially blocked, and you continuously do that. So dampness build-up takes place. And then it creates more blockages, and your chances of a heart attack is more.
Wow, very interesting. Yeah, and this is it. It's understanding our connection to nature and how it's affecting us on a moment by moment basis. And that doesn't have to be overwhelming. It's just literally being more aware of the qualities in your body and what you're feeling and tuning in. It sounds overwhelming, right? When we say you have to pay attention to all this, but no, it's really about tuning in and understanding, checking in with how you're feeling every day. Like, how am I feeling? Am I feeling heavy and lethargic today, or am I feeling light and airy? And what do I need? Like we talk about the gunas and bringing in the opposite. Yeah. So I know it can sound overwhelming, but when we really break it down and when you're understanding and have a true understanding of your unique constitution and your needs, it does get simpler, right? Because it can be overwhelming for people who are new to Ayurveda.
Yeah. And it's just, we're not paying attention. That's the thing. I think maybe another day we should talk about these vegas. We have these 13 vegas or urges or reflexes that body creates to check this. Like one of the vega is like hunger. We know hunger and we know what we need to do when we're hungry. Like, so, it's like there's one of the vega is called like the urge to, when you feel like you're sad and you need to cry. So that means you pay attention. When you feel sad, you pay attention. What am I feeling sad? You share and you get some tears out. So you process that, you release the grief from your heart. Who haven't felt light after you felt sad and you spoke to someone and you cried, right? Crying releases. So crying, the need to cry is one of the urge. And this is how we process the different emotions. But we don't have time and we don't pay attention. As soon as we start feeling sad, we just tell yourself to, got to get some work done, focus, right? Don't talk, don't show up your emotions. Yes. So your body naturally tells you. It's like when you have something stuck in your nose, you sneeze to clear that. When you have like abdominal flatulence, we need to get it out through like a fart or a burp it out. So there's a mechanism, and one of the mechanism to work on our emotions and things is through getting in touch with when we feel sad. Or when we feel anxious, and controlling your healthy gut. Ayurveda talks about a lot of the anxiety, fear, you can clear that because you're not holding, your apana moves downwards. So there is a flow happening. So apana grounds and then prana becomes active. So we have the better mental clarity and ability to process different emotions.
So true and so important. Yeah, allowing those tears to flow, because that's part of the processing of emotions. And that relates back to the heart, because if we're not digesting those emotions, then it goes back in turn to affect the heart and to affect the dhatus, the rasa and the prana, like you said. And so, Dr. Sujatha, first of all, there's another case study you wanted to share with us. I'm not sure if you have another one, but if you do, please do so. And then I'd like to move on to, what tips can you give people today in guidelines in taking care of their heart health?
I want to share one. This was with a young boy. It was in my early times of my practice under my teacher's guidance in India. This boy had a mitral valve prolapse, something I think he had it since childhood, and they didn't have the money to surgically correct it. And I've witnessed my teacher did the treatments to correct that since he was very young. I think we could build up the strength of the valves, and that healed through different Ayurvedic treatments and dietary changes. So this was one of the valve defect that I witnessed happening.
Wow, that's pretty amazing. And that valves were restored through treatment of Ayurveda.
Yes, he had a weakness involved. It was not closing properly, and the treatment did help to strengthen those valves and close the heart valves properly to prevent the mixing of the venous blood with the pure blood.
Wow. And do you remember what sorts of treatments were done in that case?
The boy was very young. I think he was around 10 years old. So we didn't do any kind of Shodhana treatment or the Panchakarma. He was on different Ayurvedic treatments, external treatments like some Abhyanga, Pirichil, chest strengthening treatments, and plus a lot of internal medication. So this is what was provided for this boy.
Okay, so a lot of the oil treatments that a child that young could withstand, because the others would be too much. Okay, great. Wonderful. It's always great to hear case studies. And so if we can move on to talking about some general guidelines for people to take care of their heart health, holistic guidelines, and thinking more holistically about their heart health.
I think anything we do to prevent ama and stay healthy and, keep the Agni good and the mind happy and curious would do the great deal of healing to your heart. It's not like it's something related to heart you need to do. Of course, laughter is a great medicine to heart. Having more joy and more fun definitely affects your heart, and loving and kindness and compassion while you do for others and giving it to yourself is one of the key thing, and keeping your mind healthy. Meditating, connecting to sattvic qualities, developing spiritual behavior patterns and spiritual awareness. That I would stress more, particularly working on heart. We call about heart opening, which is also, it's a spiritual development itself keeps your heart healthy, along with you do anything to keep yourself general health, plus spiritual qualities, I would say.
I love that. Really great advice. Great. So as we finish up here, Dr. Sujatha, is there anything else that you wanted to add today? And I also want you to tell us a little bit more about Amrita City as well, the Ayurvedic clinic, but please use this time if there's anything else that you wanted to share.
I think you have covered some of the heart herbs and food and stuff. And also things to not to do to avoid in the food wise, like excessive alcohol, excessive stimulants, it's a funny thing. Like it always intrigued me because the fat has got it's over the period people's approach to fat has changed. So fat was considered to be really good, then it turned into a monster. Now we are in a era that it's all about healthy fats and eating as much as healthy fats. I think anytime the Western researchers and science do a research, they come into a conclusion that if it works, it's good. The test shows it means that the more you do, the better. This is how it's seen, right?
Mm-hmm.
So Ayurvedic text, as I was preparing for this, I read like one of the things contraindicated and recommended not to do is also taila. That means oil. So that means in a way, it also talks indirectly. Sneha is good for heart to keep its channels lubricated and channels functioning. So it's and everywhere Ayurveda talks about in moderation. What is good doesn't mean that it's good all the time, and you can use as much as you want, or the more the better. So there is a middle ground to understand how much in each and every individual needs this oiliness or the oil or the fat. Even when we talk about a healthy fat, and because we do talk about the constitution here, and maybe the vatas need more these kind of oily oils and fats to keep their vessels and their system generally lubricated, where pitta in moderation, kapha much less than that. So that's one approach I would say. Okay, oil we need, but too much, is it good? Not good. So when we consume oil, you decide based on your constitution, your lifestyle, your output, how much physically you're active. All those things do matter. So it's not for everybody the same quantity of the oil to consume. And, garlic is considered to be a rudya along with the other things, sourness is considered to be good for heart. Because I think if you see what does sour food does it, sour helps to thin your blood. And we know that in any kind of heart condition, doctors generally prescribe you aspirin or any kind of blood thinners. So sourness keeps the blood thin. And because it reduces the density or viscosity of anything. At the same time, too much of sour is also contraindicated in heart diseases. So it's about finding a right balance, and you looking into a constitution, you choose what kind of sourness. If a sourness produces more liquid, then it is more moisture, it's good for vata. And the sourness which has a scraping effect, then it is good for kapha. So, if it is a pitta related heart condition, then you need to be careful with excessive sourness from fruits and lemon or fermented food and all those things. So, that's something along with what, you have done the episode with the heart beneficial herbs. I would bring that attention, to usage of the garlic and, need for healthy fat in diet. Plus the exercise, I do know people that they over-exercise and exhaust themselves. That's something also one need to be mindful about. And I read you exercise until you're 50% of your capacity. That means once you finish exercising, you still have the energy to do whatever other things you want to do soon after the exercise. So measuring your exercise, you can build up the stamina, you can build up the resistance, but you need to do gradually and to do only half of your capacity. Otherwise, you're going to strain your heart.
Yeah. I used to do a lot of competitive sport, and we can see that, in the endurance sports, and particularly I was doing like triathlon and Ironman, that we can see, if you're doing too much, like you were just talking about there, we have this thought process in the West, sometimes like more is better. But if you're over exercising, doing these crazy endurance events, particularly it affects the heart tissue, coming back to the heart. And there's been studies done that these huge endurance events have a bad effect, have a degenerative effect on the heart tissue. So again, it's, like you said, it's tuning in, understanding your unique constitution, understanding the qualities in your body, the gunas, and checking in daily. And that comes through this process of, getting some professional advice in Ayurveda, going through a consultation, understanding what's important for you, how to manage your imbalances, how to manage your constitution. And that will give you the clarity to go forward and not be looking at this one size fits all approach that we take sometimes in the West, but being able to make decisions in relation to your unique constitution and being able to tune into that. So you're essentially becoming your own healer. So that's what it comes down to, because if we follow these one size fits all approach, it can be so confusing. And Ayurveda is all about an individually tailored approach. And that's why it's important for you to understand your mind body type and so on. Okay. Thank you very much, Dr. Sujatha. Can you tell us some more about Amrita Siddhi as we finish? And this is where, folks, that we'll be holding the retreat December 4th to 10th. So can you tell us more about Amrita Siddhi Ayurvedic Clinic in Ubud and your offerings, please?
Yes. And it's as you mentioned, cocoon, a place for people to enhance their well-being and transform as we work on the both physical, mental, and emotional area of their health. The whole team is supporting whoever comes there who want to make some changes, understand, learn. So we provide while people are going through their healing journey. We offer education through holding Ayurvedic workshops, herb walks, and talks, and cooking classes, and all those things. So anybody who is looking to holistically approach or take a path of Ayurveda to find a solution for their well-being, this is a center, we've been running this for almost 17 years now. And it's located in Bali, in Ubud, close to the little monkey forest. And look forward to see people who are listening and who needs help, who want to make some changes, want to take health in your hand. And Colette is doing this retreat where she will be supporting the team with her own practices, and it's going to be a unique experience. So you can come with Colette retreats, or anytime you have time, you can come to Amrita Siddhi, and I think link will be left by Colette. Mm-hmm. You can just Google www.amritasiddhi.com to get more information. We don't have any educational program, but soon we are planning to start some educational program, probably next year. Mm-hmm. So is enthusiastic about learning, studying those facilities, we would like to start offering soon.
Great. That sounds very exciting. Well, Dr. Sujatha, it's always a pleasure. I can't wait to see you in person in December. And thanks as always for joining us here. And I can't wait to have our next discussion on the podcast.
Thanks, Colette. Thanks for everything that you're doing. And your podcast helped me to keep keep myself updated and bringing this information out there for people, which is my passion. And you're helping me too in doing that. Thank you.
Great. I know I learned so much to it too. So it's always exciting. Thank you, Dr. Sujatha. Have a great day, and I'll talk to you soon.
Yeah. Thank you. Bye-bye.
Bye for now. I hope you enjoyed that conversation with Dr. Sujatha, and please check out the link to Amrita City in the show notes. And also there you'll find the link to our upcoming 7-day Ayurveda Rejuvenation Retreat happening at the Amrita City Ayurvedic Clinic location in Ubud, Bali. 7 days of nurturing Ayurvedic food, treatments, all tailored to you. So please check that out, and hopefully I will see you in Bali in December. Also, you can check out the links to my online services. I offer online consultations, online Digestive Reset Cleanse, and my educational program, the Daily Habits for Holistic Health, self-paced online program. If you think that this episode will be helpful to others, please share it with them so we can spread this wisdom of Ayurveda. And if you haven't already subscribed or followed the podcast, please do so, and the new episodes will download for you on a weekly basis. You can find me on social media under Elements Healing and Wellbeing on Facebook, and my new Instagram page, the Elements of Ayurveda podcast. Thank you so much for tuning in, and until next time, take good care of yourself, be well, and bye for now. Slán go fóill.